So all we're going to do today is go through anatomy a little bit and talk about injection techniques. A little bit about myself. I'm a dental surgeon. I graduated from King's College London, and I also currently teach at King's College London as well. 2 points. For your mentalis muscle, you go all the way in with your 13mm needle, 2 to 4 units per injection site. I cannot emphasize how important it is to undertreat lower. Again, if you're a dentist or not, check your patients for masseter hypertrophy. It is very common for your patients to come with a square face to you and they want cheek enhancement, or they don't really know what's going on with their face. It really depends on your patient. It is important to understand the muscle you're injecting, how big it is, whether the muscle is bulging once, twice, or 3 times. I've been told I have 2 minutes. Thank you.
Lovely. Thank you.